My name is Dea Williamson. I work in the Parnassus Emergency Department. Since June 22nd, they have been taking our staffing down, nurses specifically, by 3 to 4 nurses per shift, and this is greatly affecting patients staying in the waiting room for multiple hours in the waiting room. It's also affecting patients. They're staying sometimes 1 to 3 days waiting for a bed upstairs, and this is greatly affecting the care and the quality of care that we give, and we're hoping that UC listens and brings back our staffing.
How long has that been going on? Because my brother, as I said earlier, was waiting 3 days for a bed. I mean, it's serious conditions.
This has actually been going on for years. Personally, another thing I left out in my speech earlier, my own father, who is dying of cancer, came in on January 19th, 2024 to the Parnassus Emergency Department and spent a day and a half in the emergency department. The staff did not have enough help, and actually the next morning my husband came off shift from the firehouse here in San Francisco and had to hold them while they drained 1.2 liters off his left lung. He was on a non-rebreather, and he was there a day and a half till he got a bed upstairs. It even affects us staff, our family members, and we're speaking up for all of our patients. We treat all of our patients the same, like we would want ourselves to be treated, our family or friends.
It sounds like a healthcare emergency. Where is the state? Where's Governor Newsom? Where's the legislature having hearings? I mean, it seems like it is a healthcare emergency right here in San Francisco.
This is a healthcare emergency. This has actually been going on for years, but it's now with the NIH funding being cut and UCSF being one of the top 2 in the nation. Around 18% of their funding comes from the NIH, and now it's been significantly cut. And then also COVID funding was cut last year, so now there's not that much, but somehow they still managed to spend over $100 million to purchase St. Mary's and St. Francis, and also now possibly on the peninsula another institution.
But why aren't any oversight of the priorities? It seems like it's become a corporate, industry company competing with Kaiser, competing with Sutter. That's their whole orientation, is being competitive in the commercial market, really, of healthcare.
I'm not very sure on that. I can't really speak, but that's what it's looking like to all of us that are facing this crisis alongside our patients. And unfortunately, we're at the mercy of the higher ups, such as our CEO, making these decisions, and they can easily stop this and bring back our staff and our colleagues who were laid off.
Well, the nurses union has called for single payer, to get rid of the insurance companies, to have single payer. That wasn't mentioned at the rally, but why do we have insurance companies in healthcare?
I honestly don't know, because if you look even at the HCA hospitals and a lot of these big insurance companies, they have investors. And again, as I stated, there shouldn't be a monetary number put on a patient's life and the care they receive, and unfortunately that is what's happening, and that should change, but I can't fully speak to that, but it's very disheartening.
Do you think that they're going to drive the workers together here? Because it seems like there's a united front of all the unions. I mean, the Children's Hospital, they're out on strike. It seems like they're driving people together to fight in a united way.
This is driving us together because this has actually affected the over 200 workers let go, has actually affected all of our unions. We are the only union, I believe, right now that's not out of contract. AFSCME and UPTE have been trying to get a contract for some time. We will be at the end of October out of our contract and be negotiating and are starting negotiations now. So we're standing united because one person let go affects everyone, and it affects the patient care, as you heard with the physical therapist that was let go after 9 years earlier. It's very disheartening.
And they're not even following seniority, apparently?
That's what they're saying. We're not clearly aware of what is happening and privy to all of that yet, but we'll find out more hopefully in the next couple of days.
Protests about the layoffs that the UCSF has wrongfully done to our unions, so we're standing up and fighting back.
They say that they have to cut the budget because of NIH, other cutbacks. What's your response to that?
I feel like that's an inappropriate way to do layoffs, because the people here at UCSF do a lot of incredible work, and using an amazing organization like the NIH is a kind of a rude way to help our patients and also serve our community.
My name is Rosita. I'm a nurse with California Nurse Association. I am a nurse over at the Mission Bay campus. I'm here because we're about to start our bargaining, and day before yesterday, a bunch of our nurses got notice, literally on their shift, that they were being laid off. My unit, which is the GI unit, got hit extremely hard. About 10 of our employees and colleagues were laid off. These are full-time employees in a unit that provides palliative care, cancer diagnosis. We work with pediatrics and adults. And so this really stems from UC trying to put this under the guise of budget, that they're somehow in the red. But we know that UC is one of the largest real estate holders in the state of California. They also decided to pay Suresh, who's the president, the CEO. When he started in 2022, he got a baseline salary of $1.85 million. So if they're trying to make budget cuts and they're saying that these employees were necessary to cut because of a budget, why are they not cutting these salaries of these high-paid executives? Instead, they're putting this cost off onto patients. So patients are going to see the aftermath of us being continuously short-staffed. We have continuously been short-staffed even before COVID. We the day before the layoffs, we were actually in a meeting with some of the top leaders of UCSF, and we were talking and we were discussing the fact that a lot of our units are short-staffed, including the birth center, which is actually a hospital within a hospital, and sees some pretty high acuity patients. So this is all an insult, a slap in the face, with over 200 on our campus that are being laid off. This affects the UPTE members, AFSCME, and CNA. These cuts are going to hurt our patients and our community.
And will they say that NIH cuts and the federal government, that this is what they have to do?
UCSF has $41 billion in endowments. That's more money than even small countries have. So this attack on a budget and cutting our essential staff is just a gaslighting. It is like gaslighting at its worst. Again, UC is one of the highest real estate owners, plus they just bought 2 more hospitals. So all of this is coming at a time where they can blame NIH cuts, they can blame Medicare cuts, but we know the bottom line that they've been wanting to do this for some time. Again, why are they not cutting the Regents? Instead, the Regents just got 27% raises. And Suresh, the president, just got a raise. It was nice to give himself a raise while we're now having discussions with nurses who actually even just had children, who one is on paternity leave. I mean, this is ridiculous. To cut people that are essential and vital to the function of a hospital is insulting.
And there's a strike on at Children's Hospital, Benioff Hospital in Oakland. They want to take away their benefits. They have free health care. Which all workers should have, especially healthcare workers. They want to bust them and tell them they can't belong to the union they want to belong to. What do you think about what's going on? You think that this is basically a union-busting drive carrying on what Trump wants?
So not just union busting, these are attacks on workers' rights. We're seeing it roll out across the nation, and unfortunately our institution is leaning into these and using these as an excuse to cut whatever they can, because again, they treat healthcare like a business. They treat the community like they are business partners, but they're not. These are our community members that are going to be suffering. And this is our staff that show up every day and are dedicated to our community, dedicated to the healing and to the craft of healthcare. These cuts are going to hurt deep. And the fact that, we sit here and we say, this UCSF says these slogans about equity care, caring about healthcare. It's all ridiculous. It's gaslighting.
And also, there are trillions of dollars for war. It seems like there's an unlimited budget for the war in Gaza. Their staff, people have been told they can't wear a kafaya here. They're cutting down on democratic rights, even attacking the right to leaflet at the campuses. What's going on?
Again, these are all worker right attacks. These are all attacks coming from the right wing. This whole motto of leaning in to all these bad things that are coming down, across the nation, it's extremely hurtful. But the thing is we're unionized. California is a strong union state. We're going to continue to fight back. We're going to continue to fight for the rights of all of our colleagues, whether they're an UPTE, CNA, or AFSCME. We're going to continue to fight, and we're going to be strong together. The fact is we are the community. We are the backbone of these healthcare systems, and we know that UCSF is treating this specifically as a business model, not a non-for-profit, not as a healthcare or a healing institution. UCLA actually is invested in some of the largest surveillance companies that actually give data to ICE. So you can tell where the UC system lies with their rhetoric.
And it seems like all the workers together are being forced to fight together. You think this is going to lead to action statewide of all the workers and the students who face the privatization, the fees and registration? I mean, it seems there's an onslaught both on public universities, part of the program of Project 2025, which is to get rid of all public universities. I mean, UC is competing with other medical chains. They're supposed to be a nonprofit. Yeah. They're competing with Stutter, Stanford, Kaiser, and it's a corporate, isn't that a corporate structure? And that's why they want to get lower wages and attack workers?
Absolutely. They're saying that the cost of labor is too high. Well, that's because we're unionized, and they want to take those protections away. We have fought for safety. We have fought for our community. And if they think that we're just going to shut up and just take it, we're not. We're in for this fight all together. And it's, hey, look, we're all in it together. They're going to have to fight a whole bunch of us, and we're not going to back down. We're going to continue to speak up, speak out. We're going to continue to fight this in every way that we can.
We got to fight for our rights. There's a lot of cuts going on, and without, us advocating, nothing will happen. So we're here.
Elizabeth Milos, I'm a medical interpreter here at UCSF.
And it sounds like this is a major attack on the unions, all the workers, and the community.
It is. It's a major attack because they don't even respect the contract, which should have made it 60 days notice in order for any kind of layoffs. They should have given 60 days notice, and they're not respecting seniority rules either. And honestly, as a medical interpreter, I see patients whose lives are literally saved because of the physical therapist. There was a physical therapist that spoke here, and if we're going to not have enough physical therapists, the elderly patients or the patients that have just... Hold on. We're getting a lot of support, thanks to God. The elderly patients, it's okay, you can do that first if you want to. The elderly patients and the patients who have come back from surgery need to get out of bed as soon as possible. And if you don't get out of bed, you lose your function. You can get pneumonia. Pneumonia infections are very common for elderly patients that are stuck in bed for a long time. And physical therapists literally save lives. Also, wound care is greatly diminished because, now they're saying also the nurses. So we're going to be having difficulty with that. People that are in bed for long, they literally get infections that go straight to the bone.
And they're building a big hospital here, billions of dollars for hospitals. I mean, what's going on? Seems like they have money for expansion.
UC has been increasing its management load for quite some time. In terms of new hires, they were hiring managers at a really big, fast pace before, and now they're knocking off the actually frontline workers, and they're building hospitals here, research over there, over at General Hospital as well, a big research unit over there. But then they're firing people that are actually going to be doing the jobs. Who is going to be doing the job? Are they going to rely on techs to do the labs? They're the clinical lab scientists that are going to be laid off. They're the ones that are trained. They're literally scientists, and they're trained to be able to distinguish between what kinds of cells patients have, so that we can catch these infections or these life-threatening conditions in time.
So the governor Newsom, Tony Thurmond, they're both on the board as ex officio. Where are they? Because it seems the Democratic state I mean, the legislature has a supermajority. They could have oversight hearings immediately. It's a flagrant union busting attack.
Well, you know, unfortunately, they've been allowed, UCSF has been allowed to have its own little personal kingdom here for a long time. They don't even bother responding to cease and desist letters.
Well, they don't even mention it here about the Democrats and Newsom at this rally. Why are they silent about the governor?
They're not mentioning, you know, none of the unions are really mentioning anything having to do with the Democrats. In fact, you know, Kim Taglioni spoke here from the Labor Council. She's the executive director. Every single time when I was a member of the Labor Council, they would be endorsing candidates, for example, to the Democratic National Committee that were in favor of privatizing education. And I've never seen them go against any Democrats at all.
Well, they don't even mention Newsom, who's the governor. Where does he stand? I mean, they could say, stop these layoffs, stop the attacks.
Right, they don't mention the governor, but also our own unions. They don't give the tools to people. They're saying, okay, our union is going to be putting the cease and desist. Our union's we're going to have these meetings, things like that. That's good, having those meetings. But there's a lot of things that each of us can do individually. We can file incident reports of every single time that a patient gets delay in care based on these staffing cuts. Those are incident reports. Every time a patient has any kind of like high glucose level that they were mentioning here, things that could have been taken care of.
Should they file criminal charges? I mean, people are dying.
Yeah,
a criminal charge against these CEOs?
If people are dying, then the CEOs are responsible. Correct. If people die, the CEOs are responsible for that. We should do adverse event notification. We should file, every single one of us needs to file incident reports from every time that we see this happening.
Also, there's a strike going on at Children's Hospital, NUH, the engineers. They're busting the union there. They want to transfer them into the other unions against the will of the members. It seems like a flagrant union busting attack. And at UC Children's Hospital, they have free health care.
Well, UCSF, UC actually promised the unions at Oakland that they would not touch their benefits, or they would not change their working conditions, and they went back on their promise, basically. So what we can learn from this is we can't trust UC to fulfill any of its promises, because they don't even respect us. In fact, for these next bargaining sessions, they're refusing to even allow, that my union is involved in, UPTE, they're refusing to even provide a space for these bargaining sessions to take place in July. And if that's not union busting, I don't know what is.
Why aren't the unions taking action statewide, all the unions that you see, and saying we're going to shut this institution down because they're flagrantly union busting? Seems like they're basically, you know, letting out the calling on the gauntlet to say to you, what are you going to do as a united union? And it's never happened.
Well, traditionally we've been separate unions. Of course, we have the nurses union, UPTE, the professional technical workers, AFSCME, and in reality we do need to stand together, because we're not going to be able to fight this alone, even with their own little separate contract negotiations and bargaining. We need to unite and fight this together.
And they're not, are any of the unions leafleting the patients here? Because they talked about, and you talked about, the conditions of the patients, the overflow. This has been going on for years in the emergency room. Are the unions informing the patients by leafleting them and explaining what's going on? The people of California are getting ripped off by this state-run institution.
As far as I know, none of the unions are contacting the patients regarding this.
Why is that?
I think that even more so, and I brought this up at the Labor Council at one time with regard to Kaiser, the strike going on at Kaiser at that time. The Labor Council has access to 100,000 union members in the city of San Francisco. They could send a letter out to all the union members for them to send out letters to UCSF right now, today, to tell them to negotiate fairly, to stop these layoffs, and to improve patient care and respect them. I mean, the Labor Council could do that if they wanted to.
Why aren't they?
Well, I don't know. I think that in general it's because they don't want to rock the boat that much. They're saying that they're for us, but I don't see them doing anything in reaction.
You could have a statewide action of all UC healthcare workers, of the people who need healthcare. I mean, UC wants to be competitive with Sutter, Kaiser. I mean, it's a corporate structure that is a union-busting corporate structure, and that's...
Yeah.
Raise the issue of single payer, getting rid of these insurance companies. I mean, UC, it seems the management are an insurance company now, and they're saying we want to make more profits by attacking the workers.
You know, I'm glad I saw District 5 supervisor here, but we need the legislature also on board, because the legislature supposedly approves part of the budget of UC. This is basically union busting, and they've been doing that for quite some time. In fact, UCSF is using the law firm Paul Weiss, for example, which is this law firm that is paying, that is giving free legal support to the Trump administration in an amount of $4 million to attack the Dr. Rupa Myra, who's a doctor who was speaking out regarding Palestine, and I'm being attacked right now. So they have money and administrators to attack workers for speaking out against the killing of our colleagues in Gaza, which it is happening. 1,000 healthcare workers or more have been killed, and there's 400 that are detained and being tortured at this time. And
what's UC saying about that?
UC is basically attacking us. I'm being subjected to an ethics and compliance investigation for calling out a doctor who told me to take off my kufeya, and when I refused, basically they're going after me in many other different ways. So they have the money to do that. They have the money for these administrators to waste time on doing that instead of actually, you know, improving health care.
One of the issues is the Democrats. The Democrats have control of the legislature. They're silent about this. The governor's silent about it. You think it's time for workers to have their own political party?
Yes, we need a workers' party, definitely. A workers' party where we include all workers, every single one of them. And this thing about having, you know, of course, every union has specific issues having to do with their own particular job titles and things like that. But we need a confederation of unions. I mean, the AFL-CIO pretends to be a confederation of unions, but the AFL-CIO doesn't really, they're not really protecting us. And in fact, they've been very instrumental in going along with the Democrat, union bureaucracy, and shutting down union voices and union members, and including interventions in other countries like in Chile, for example. They're spending money on doing things like that instead of defending the workers.
Well, the Solidarity Center of the AFL-CIO gets $70 million a year from the U.S. government for international operations. If they were really fighting these multinationals, they probably wouldn't be getting the money. And it seems like you see the workers here are under the gauntlet, and there's no even mention here of single payer, of public health care for all, of getting these insurance companies out of the business. That wasn't mentioned here at this rally. It's all working people who are faced losing their health care or having to pay more and more out of their wages.
Single payer is the big elephant in the room.
It's not mentioned here.
And nobody's mentioning single.
Why is that?
Well, because basically I think a lot of the politicians, including some of the UC Regents, probably have money invested in these big pharmaceutical companies and these big, you know, so-called healthcare, quote-unquote, industry, which it should not even be considered an industry because it's something that saves people's lives. So I think it's because and the legislature, of course, gets a lot of funding. And
Newsom promised he would support single payer, and he dropped that. He took money for a personal party from the Hospital Association. The legislature is refusing to act on single payer in California. There's an emergency. From what they're saying here, there's an emergency right now in San Francisco at UCF in the emergency room.
Yeah, you know, UC likes to pride itself, let's say you have the word pride, which includes the word excellence, right? They like to pride themselves on being like top-notch care and everything like that. So that's what they sell to the patients. But here you heard nurses talking about basically conditions that we see in third world countries, okay? People being in the hallways on gurneys waiting 2 or 3 days to be able to find a bed and getting their care in the hallways or in the ER waiting rooms. Those are things that are not supposed to happen at UC for the amount of money that they charge patients, because I'm a UCSF patient, okay? For the amount of money that they charge patients for the care in their premiums and things for the care here, and for all the excellence talk, it's pure BS, basically.